Please give a big round of applause to all. It's a humble request. Thank you so much, sir. Now, may I request to Vice Chancellor, sir, to hand over a sapling to our Pro Chancellor, sir, Mr. Nishant Bansalji. Give a big round of applause. With a great pleasure, I invite our Pro Chancellor, Mr. Nishant Bansalji, to extend a token of sustainability and warmth by handing over a sapling to our guest, Dr. Mandeep Maan, sir. Give a big round of applause.
May I humbly request our Vice Chancellor, Dr. Vikas Singh, to kindly offer the sapling to our honored Dr. Anurag Khatkar, representing our shared commitment to a greener future.
May I request our Principal, sir, Dr. Sunil Javla, to kindly present a sapling as a token of welcome and respect to our guest, Dr. Rohit Dutt.
I warmly invite our Pro Vice Chancellor, Dr. Gulshan Chauhan, sir, to bestow the sapling upon our resource person, Dr. D.C. Bhatt, symbolizing growth, harmony, and lasting collaboration.
Now may I request our respected Principal, sir, Dr. Sunil Javla, to do the honor of presenting a sapling to our resource person, Dr. Mukesh Kumar, sir. Give a big round of applause. With a great pleasure, I invite Professor Dr. Sarita Khatkar ma'am to extend a token of sustainability and warmth by handing over a sapling to our guest, Dr. Vineet, sir. Give a big round of applause, guys. Now may I request our Professor Dr. Amit Latha, sir, to kindly present a sapling as a token of welcome and respect to Dr. Rakesh Kumar, sir. Thank you so much, sir. May I humbly request Professor Dr. Seema Rohila to kindly offer the sapling to our guest, Dr. Ritu Kataria, for representing our shared commitment to the gesture future. Thank you so much.
So let's begin this journey of knowledge, discovery, and collaboration together with the lighting the lamp, followed by seeking blessing from Ma Saraswati by enchanting Saraswati Vandana of Goddess Saraswati, the provider of learning, knowledge, and wisdom.
I humbly invite our esteemed dignitaries to kindly come forward for the lighting the ceremonial lamp. Please, sir and ma'am. As the lamp is lit, may its radiance touch each one of you, kindling in you the immortal flame of knowledge and understanding.
सदा वंदिता
Saraswati. Thank you, Ma Saraswati, and all the dignitaries for blessing the occasion with your auspicious presence.
Thank you so much to all the dignitaries. With great pleasure, I invite Dr. Sunil Javla, sir, to extend the token of respect, of sustainability and warmth by handing over a sapling to our one of another principal we have, Dr. Rahul Sharma. Give a big round of applause. Thank you so much, sir. Moving ahead, as someone has rightly said, knowledge increased by sharing, not by saving. Now I request to our esteemed dignitaries, our chief guest, Dr. Deependra Singh sir, our Pro Chancellor sir, Mr. Nishant Bansal sir, Vice Chancellor sir, Professor Dr. Vikas Singh, Professor, and our Pro Vice Chancellor sir, Professor Dr. Gulshan Chauhan, our Principal sir, Dr. Sunil Javla, guest Dr. Anurag sir, Dr. Mandeep Man sir, Dr. Rohit Dutt, Dr. DC Bhatt. Please come forward and have a seat on the stage. Your presence on stage will add a great value to the significant moment of this event. Thank you so much to all the dignitaries present here.
Well said by Henry Ford. Coming together is a beginning, staying together is a progress, and working together is a success. Now I would like to invite our Principal Dr. Sunil Javla of Geeta Institute of Pharmacy on the podium to deliver the welcome address. Dr. Javla has been working proactively to ensure the successful organization of this conference. His guidance and leadership have contributed significantly to shape this vibrant platform for sharing knowledge and information about pharmaceutical research and innovation. He will now provide an overview of this two-day intellectual program.
Thank you so much, sir. Give a big round of applause for the principal, sir.
Very good morning. A very warm welcome to everyone present here. It is my proud privilege to welcome you all to the second international conference on New Frontiers of Pharmaceutical Research 2025. It is organized by Gita Institute of Pharmacy in association with Indian Pharmaceutical Association, Haryana branch. We are truly honored by the presence of our visionary leaders, Honorable Pro Chancellor Shri Nishant Bansal ji, Vice Chancellor Professor Vikas Singh, Pro Vice Chancellor Professor Gulshan Bansal, whose inspiring leadership continues to elevate our academic ecosystem. A special and heartily welcome to our chief guest, Dr. Dipender Singh, Chairman, Education Regulation Committee, Pharmacy Council of India. Please give a big hand and welcome him at the Gita University campus. Dr. Singh is a distinguished figure in the field of pharmacy education and regulation, known for his instrumental role in updating and aligning pharmacy curricula with modern healthcare standards. His leadership at PCI has promoted a shifting towards the complete education in pharmacy, ensuring that pharmacy graduates are able to meet global education standards. We are deeply privileged to have him with us today. We are very grateful to esteemed presence of senior representative from key professional organizations, Shri Mandeep Manji, Member Central Executive Council, IPA. He is Secretary also at IPA Haryana branch, DCO of Rohtak. Dr. Anurag Khatkar ji, President, IPA Haryana branch. Dr. Vineet Mittal, Vice President, IPA Haryana branch. Dr. Rohit Jadji, Vice President, Northern Region, APTI. Your contribution towards education policy, pharmacy, advocacy, and professional development had a profound impact on shaping the future of pharmacy in India. In addition, we are privileged to host an exceptional panel of keynote speakers and resource persons, including Professor D.C. Bhatt, who will soon join us, Dr. Mukesh Kumar, President, KV Industries, Pennsylvania, USA, Mr. Ankush Bhandari, Senior Manager, Deloitte, New York, Dr. Manish Kumar, Scientist, National Agri-Food Biotechnology Industry, Punjab, Professor Dr. Deepak Kaushik, HOD, Department of Pharmaceutical Sciences, MDU, Rohtak, Mr. Mandeep, Community Pharmacist, Australia. So these sessions will cover a broad spectrum of emerging areas such as regulatory science, advanced drug delivery systems, artificial intelligence applications, and evolving pharmaceutical landscape. I would like to acknowledge the presence of respected principals of other institutes. Dr. Ritu Kataria Madam, Treasurer, she is also Treasurer at IPA. Dr. Rakesh Gupta, Joint Secretary at IPA Haryana branch. Dr. Rahul Sharma, along with all faculty members, research scholars, delegates, and most importantly, our vibrant students. We are also delighted to share that this conference is being hosted live on YouTube, enabling us to connect with the delegates, academicians, and researchers from across the globe. This digital outreach extends our mission of knowledge sharing and collaboration beyond physical boundaries. This conference will also showcase a series of oral and poster presentations. I urge all participants to take full advantage of these sessions and engage in meaningful discussions and build connection with all the keynote speakers. Let this conference may not only expand our understanding of pharmaceutical frontiers, but also ignite meaningful collaborations for future growth. Once again, I heartily welcome you all in this international conference. Thank you so much. Jai Hind.
Thank you so much, sir, for your warm words of welcome. Now it's time to unveil the official proceeding of this conference. This proceeding captures the essence of the scholarly gathering with research abstract, institutional achievements and thoughtful contributions from the academic community. May I now take the honor of inviting our esteemed dignitaries for the release of the conference proceeding. Remember that we are here with the participation from both national and international researchers. ICNFPR 2K25 offers a rare confluence of the global perspective, reminding us that the science know no border, only share the goals. We have received abstract not only from the India but also from all over the globe, which makes our proceeding a must-read latest technological proceeding book for the scholars and research fraternity. Please give a big round of applause for this beautiful moment. Now may I invite Dr. Mukesh sir, please come to the stage to have a seat. Thank you so much to all the dignitaries.
It is the supreme art of the teacher to awaken joy in creative expression and knowledge.
Now I humbly invite Honorable Dr. Vikas Singh, our Vice Chancellor of Gita University, on the podium to say some words. As the founding Vice Chancellor of Gita University, he has worked tirelessly to build a culture of academic excellence and professionalism. He is a dynamic leader who contributes to guide us and inspire us to become better. Please give a big round of applause for our Vice Chancellor, Sir Dr. Vikas Singh. Please, sir.
Good morning, everyone. Honorable Chief Guest, Dr. Dipender Singh Ji, Chairman of Education Regulations Committee, Pharmacy Council of India, Honorable Pro Chancellor Nishant Bansal Ji, the esteemed guests to this second international conference of Pharmacy Department, Shri Mandeep Manji, Member of Central Executive Committee, IPA, and Honorable Secretary of IPA Haryana Branch, our very own Dr. Anurag Khatkar Ji, President of IPA Haryana Branch, Dr. Rohit Dutt, Vice President of Northern Region from APTI, very respected Speaker for Day 1, Professor D.C. Bhatt Ji, Dr. Mukesh Kumar Ji, all the faculty members, the faculty members and principals of other institutes, all the participants and presenters in this second international conference, and dear students of Pharmacy Department of Gita University. I welcome each one of you to this second edition of International Conference. The conference, when we discussed, me and Dr. Jawla, we discussed that the conference should be more focused on the area of research, like what are the new frontiers in pharmaceutical research. And during that discussion, we discussed some of the challenges before the pharmaceutical industries in India, and what are the opportunities which are available and how universities can play a role in it. As all of you must be aware that in last 20 years, Indian pharmaceutical industry has created a lot of impact across the world. In fact, if we talk of India, after IT industry, the second largest export that India is doing is of pharmaceutical drugs. But I believe in this direction lies the main opportunity. As far as Indian pharmaceutical exports are concerned, if we talk in terms of volume, India is one of the 3 largest exporters to US. जो दवाइयां हम भेजते हैं वहां पे, हम 3 largest exporters में से एक हैं, one of the 3 largest. But if we talk of value, not the volume, if we talk of the value, then we are not even in the top 10 exporters to US. What this means? This means we are known for our volume, but we are not known for our value. Indian pharmaceutical industry जो एक्सपोर्ट कर रही है, वो क्या एक्सपोर्ट कर रही है? हम एक्सपोर्ट करते हैं जेनरिक ड्रग्स, एंड दोज जेनरिक ड्रग्स आर नॉट वेरी वैल्यूएबल, दे आर लार्ज इन वॉल्यूम. तो इसलिए बड़ा फेमस है इंडियन फार्मास्यूटिकल इंडस्ट्री के लिए दैट वी सेंड मेडिसिन्स इन ट्रक एंड वी रिसीव पेमेंट इन एनवेलप्स. ट्रक भर के दवाई भेजते हैं और एक एनवेलप के अंदर हमारा पेमेंट आ जाता है. If you look at the export from US to India, it is other way around. They send drugs to us in envelope and we have to send them back money in trucks. What it means, the value proposition is in favor of America or the imports. हम लोग क्या भेज रहे हैं अमेरिका में? पैरासीटामोल. और वहां से हम क्या खरीद रहे हैं? इम्यूनोथेरेपी की ड्रग. एक 10 ml का इंजेक्शन इम्यूनोथेरेपी का 4 लाख रुपए कॉस्ट कर रहा है, और हमारा 4 लाख रुपए के अंदर हम एक ट्रक भर के पैरासीटामोल भेज दें. तो वहां से आया 10 ml का इंजेक्शन और हमने भेजा 4 लाख रुपए का पैरासीटामोल. सो व्हाट इज द नीड ऑफ द आवर? इंडिया हैज largest number in the world of pharmacy students enrolled in a country. हमसे ज्यादा फार्मेसी के अंदर बच्चे पूरे दुनिया में किसी देश में एनरोल्ड नहीं है. It means we have the largest platform available. But what is missed? We miss high edge research. We are working on generic medicines for which somebody else had the patent. पेटेंट किसी और के पास था, उसका पेटेंट एक्सपायर हो गया तो हमने उसको जेनरिक बनाना शुरू कर दिया. But we are not doing research to create new drugs. जो ड्रग डिस्कवरी का फील्ड है वो हमारे पास डेवलप नहीं है. आज बड़ा अच्छा मौका है कि दीपेंद्र सर यहां बैठे हुए हैं. ड्रग डिस्कवरी के लिए पूरा इकोसिस्टम चाहिए. उसमें यूनिवर्सिटीज क्या रोल प्ले कर सकती है? Universities can provide very good quality students. University can provide very good dedicated researchers in the shape and form of teachers. And as a team, those teachers and those students can contribute to the research process. As university, we can create such platform like this international conference, where we can invite minds from different areas to stay together, to sit together, to brainstorm together and work on different new medicines. But what we lack in India the research laboratories having that competence, having that kind of technology, that kind of machines. आज दीपेंद्र जी हैं, मैं उनसे रिक्वेस्ट करना चाहूंगा कि कुछ हमें पीसीआई की तरफ से, कुछ गवर्नमेंट की तरफ से सपोर्ट मिले, कम से कम अच्छी यूनिवर्सिटीज को, जो एक रिसर्च इकोसिस्टम पूरे देश में डेवलप हो सके. हमारे पास छात्रों की कमी नहीं है, स्टूडेंट्स की कमी नहीं है, टीचर्स की कमी नहीं है, but that ecosystem which is required is very essential. Why Indian companies also are not coming out with these cutting edge products? हमारे देश के अंदर कितनी सारी डेथ्स हो रही हैं आजकल कार्डियक फेल्योर से. क्या आपने एक भी न्यूज आर्टिकल पढ़ा आपने ऐसा? ये बहुत आर्टिकल्स पढ़े होंगे, कार्डियक फेल्योर से लोगों की डेथ हो रही है, यंग बच्चे मर रहे हैं, जिम में जाके बच्चे मर रहे हैं, यंग सीईओज, यंग प्रोफेशनल्स की डेथ हो रही है. और हम लोग क्या बोल रहे हैं? हम लोग बोल रहे हैं कि दिस इज हैपनिंग बिकॉज ऑफ द कोरोना vaccination, without any data, without any research. But this is an opportunity. If we can put in research in this direction, हम मैनेजमेंट के अंदर बोलते हैं टेस्ट केसेस. There are so many test cases available. Can't we do research in this direction and prepare one vaccination which can avoid the incidence of heart attack? One medicine by any Indian company can bring huge revenue, huge name to Indian pharmaceutical industry. हम लोग क्या मानते हैं कि only Pfizer, only Abbott, they can come out with good cutting edge research. हमारे जो Sun Pharmaceutical है, जो Torrent Pharmaceutical है, जो अपना local Mankind Pharma है, why cannot they come out with such research? The reason is the business that we are into. जिस business में Sun है, जिस बिजनेस में टोरेंट फार्मा है, जिस बिजनेस के अंदर मैनकाइंड फार्मा है, देयर प्रॉफिट आफ्टर टैक्स, वो वॉल्यूम्स तो बड़ा बना रहे हैं लेकिन प्रॉफिट मार्जिन उनके बहुत कम है. पैरासीटामोल बना के और पैरासीटामोल बेचकर आप क्या प्रॉफिट मार्जिन रख सकते हो? वेरी लिमिटेड, वेरी कॉम्पिटिटिव. सो देयर प्रॉफिट आफ्टर टैक्स इज वेरी लिमिटेड. इंडियन कंपनीज आर नॉट अर्निंग मनी इन द सेम ट्यून एज Pfizer is earning. हमारे देश के अंदर जब कंपनियों की अर्निंग कम है तो उनका रिसर्च R&D इन्वेस्टमेंट बहुत कम है. All Indian companies from Sun to Torrent to Mankind, जो बड़ी फार्मेसी, their R&D budget is 5% to 7% of profit after tax. 5% to 7%. While in case of Pfizer, it is more than 18%. About 20% of their profit after tax is invested into research and development. Why? Because they have large profit margins, they are making good money, and they are investing that money to bring out new patents, to bring out new drugs, to come out with new drug discovery. That ecosystem is missing in India right now. हमारे यहाँ एक कंपनी है जो बहुत अच्छा इन्वेस्ट करती है. आप सबने उसका नाम सुना होगा, उसका नाम है पतंजलि. कोरोना का टाइम आया, उन्होंने क्या दवाई निकाली? कोरोनिल. और कोरोनिल बिकेम सुपर हिट. सब लोगों ने, कोरोना था या नहीं था, कोरोनिल खरीदो. स्टॉक आउट हो गया, पूरे देश में मिलनी बंद हो गई. बट द चैलेंज इज द कंपनी पतंजलि इज इनटू आयुर्वेदा. नाउ आयुर्वेदा हैज नो रिकॉग्निशन आउटसाइड इंडिया. द ओनली मार्केट दैट, आज पतंजलि 70,000 करोड़ की कंपनी है. Their market worth is 70,000 crore. But the challenge is that their new drugs will not be accepted by FDA of America. अमेरिका उसको एक्सेप्ट नहीं करेगा, उसको ब्राजील एक्सेप्ट नहीं करेगा, उसको कनाडा एक्सेप्ट नहीं करेगा, उसको यूरोप एक्सेप्ट नहीं करेगा, because they don't believe in Ayurveda. They believe in allopathy. So the ecosystem which is required to bring out new allopathic drugs is to be created in India. As university, we are ready to play our part, and I am very confident कि आप सब लोग भी अपना पार्ट प्ले करने को तैयार हैं, है कि नहीं? As students, all of you are ready to play your part. Teachers तैयार हैं, but we need some support from Pharmacy Council of India. We need some support from Government of India so that we can create this kind of ecosystem. Another thing is the mentality of Indian consumer. हमारे यहाँ सबसे ज्यादा दवाई कौन सी बिकती है? हम उसको बोलते हैं OTC. OTC मतलब क्या होता है? ओवर द काउंटर ड्रग. हमारे यहाँ जो कंज्यूमर है, जो पेशेंट्स हैं, वो डॉक्टर को भी पैसे देने को तैयार नहीं है. इसके अलावा कल फर्स्ट, आप देखिएगा, कल 1 मई को सुप्रीम कोर्ट ऑफ इंडिया ने एक बड़ा यूनिक सा डिसीजन दिया है. क्या डिसीजन दिया है कल उसने? दे आर ट्राइंग टू वर्क ऑन द डायरेक्शन to make it mandatory for Indian doctors to prescribe only generic medicines. वो क्या बोल रहे हैं कि सिर्फ डॉक्टर इंडिया में जेनरिक मेडिसिन प्रेस्क्राइब करेगा. आप चेक करेगा टाइम्स ऑफ इंडिया या किसी भी चैनल के अंदर. क्यों? क्योंकि ड्रग कंपनीज डॉक्टर्स को ब्राइब करती है अपना ब्रांड बढ़ाने के लिए. अगर ब्रांड की सेल नहीं होगी, अगर फार्मेसी कंपनीज अपनी सेल नहीं करेंगी, तो उनका प्रॉफिट कभी बढ़ सकता है. और कभी प्रॉफिट नहीं बढ़ेगा तो क्या कभी रिसर्च में इन्वेस्टमेंट बढ़ सकता है? द पॉइंट इज मेंटालिटी. द आईटी इंडस्ट्री और इतना ग्रो किया इंडिया के अंदर, तो क्यों आईटी इंडस्ट्री ग्रो किया? क्योंकि हमने आईटी को अलग तरीके से वैल्यू किया. हमने बोला सॉफ्टवेयर इंजीनियर्स कुछ यूनिक काम कर रहे हैं. ऐसे ही हमको रिकॉग्नाइज करना होगा, हमको क्रेडिट देना होगा फार्मासिस्ट का, रिसर्च वर्क का. हमें फार्मेसी के टीचर्स को, फार्मेसी के इंस्टीट्यूशंस को वैल्यू करना होगा. हमें एक इकोसिस्टम बनाना पड़ेगा जिससे फार्मेसी की न्यू एज रिसर्च में काम हो सके. एंड आई एम वेरी हैप्पी एज वाइस चांसलर दैट गीता यूनिवर्सिटी इज टेकिंग स्टेप्स इन दैट डायरेक्शन. दिस कॉन्फ्रेंस which is focused on research is a step in that direction. And I assure the IPA members, I assure Dipendraji that as Gita University, we are all very committed to increase, to grow the research culture in pharmacy department at our university. And I believe the people will also start contributing in that direction. I wish every success to this international conference, second edition. The team of Dr. Javla, our very worthy principal, they have put in great efforts to make this platform such a vibrant platform. I am very happy, he didn't mention, but I am very happy that we have more than 300 registrations for this second edition of our conference. More than 300 and 350. Yesterday in the morning he mentioned 300 plus, 350 plus, which shows that the efforts of this very competent team of teachers and professors of pharmacy department of Gita University is using their influence, is using their network, is using their good brand to attract so many people to contribute to this conference. And I'm very confident with time, this conference is going to make a name for itself. And I'm especially thankful to IPA for extending their support. And I wish all the success to the second edition of International Conference. Thank you so very much.
Thank you so much, sir, for your inspiring words. I welcome our resource person, Professor Dr. D.C. Bhatt, Professor at the Department of Pharmaceutical Science, Guru Jumbeshwar University of Science and Technology from Hisar. I welcome Dr. Ashima Huda ma'am, Principal of South Point of College of Pharmacy from Sonipat. Give a huge round of applause for both of them. Now may I request Dr. D.C. Bhatt sir to please have a seat on the stage. Thank you so much, sir. Now I would like to invite our PVC sir to hand over a sapling as a token of respect to our resource person, Dr. D.C. Bhatt sir. Thank you so much. Now I would like to request Dr. Saida Khatkar ma'am to hand over a sapling as a token of respect to Dr. Ashima Huda ma'am. Please give a big round of applause. Thank you so much, ma'am.
Now I have the honor of inviting our esteemed Pro Vice Chancellor, Professor Dr. Gulshan Chauhan sir. Dr. Chauhan is a pillar of leadership and vision at Gita University, and we continue to prosper under his expert mentorship. Sir, we are truly grateful for your guidance and constant support throughout this event. May I now request Professor Dr. Gulshan Chauhan sir to kindly come on the dais to say some.
Please.
Good afternoon to all of you. Very admirable Chief Guest, Dr. Dipender Singh, who is the Chairman, Regulations Committee, Pharmacy Council of India. Our Honorable Pro Chancellor, Shri Nishant Bansal ji. Dr. Vikas Singh, our Honorable Vice Chancellor. Keynote speakers, Dr. Mandeep Man, who is the member Central Executive Council IPA and Secretary IPA Haryana branch and DCO Rohtak. Dr. Anurag Khatkar, who is the President of IPA Haryana branch. Dr. Rohit Dutt, Vice President Northern Region APTI. Dr. DC Bhatt, Dr. Mukesh Kumar, Dr. Vansh Kumar and Dr. Deepak Kaushik, Dr. Rohit Gupta, Dr. Ritu Kataria, Dr. Vineet, and honored guests, delegates, media persons, deans, registrar, head of the school, my faculty colleagues, and dear students. On behalf of the Gita University and the conference organizing committee, I am really delighted to welcome you all for honoring our invitation and grace the occasion. My special thanks to the delegates from industry and academia who joined us to present their research papers and thus making this conference a great success. Gita Group of Institutions is having the legacy of about 40 years and offering education from KG to PhD through its various schools and colleges. Under the umbrella of Gita Group of Institutions, the Gita University was established in the year 2022, just 2.5 years back, as a state multidisciplinary private university. And presently, Gita University is offering more than 72 programs at graduate level, postgraduate level, and the doctorate levels in the various specializations of engineering, commerce and management, computer application, sciences, hospitality, pharmacy, nutrition and dietetics, forensic science, law, arts, psychology, agriculture, etc. Sir, Gita Technical Hub, we have founded a company which train the students on the skills of the required by the industry, having the academic tie-up with various reputed companies for the certifications like Cisco, Red Hat, GitHub, EC Council, Oracle, CompTIA, Amazon, AWS, HubSpot, etc., where the students are certified on the platform of these organizations. We are also having another vertical, that is the Gita Finishing School, who providing training on the soft skills and the personality development to develop the students more employable after completion of their programs. Gita University is the first university in Haryana who implemented the National Education Policy 2020 guidelines from the day one of its establishment. Under the flexible choice credit system, the students can design their own degree by choosing core electives, open electives, skill enhancement, industry embedded courses, internships as per their wish and passion, either from the MOOC platforms or the class. Indian knowledge system courses are being offered as open elective courses. For example, that is the paradigms of management from Bhagavad Gita, yoga, Indian health, wellness and psychology, Indian governance, administration and management system, and many more. Outcome-based education is delivered from very first day, and we have followed the guidelines of NHEI QF judiciously from the day one. Sir, this international conference, New Frontiers of the Pharmaceutical Research 2025, is the second international conference being organized by Gita University, and it is the second international conference organized by the Gita Institute of Pharmacy. Gita University also launched its multidisciplinary peer-reviewed open access journal Innovation in its first year of establishment and continuously publishing the biannual issues. Today, as we stand at the crossroads of the unprecedented scientific breakthroughs and global health challenges, the importance of pharmaceutical research cannot be overstated. From developing life-saving vaccines and cutting-edge therapeutics to understanding drug resistance and personalized medicine, this field continues to shape the future of healthcare in transformative ways. This conference is more than a forum for scholarly exchange. It is a catalyst for progress. These 2 days, we will witness a convergence of brilliant minds from across the globe, scientists, academicians, industry experts, and young researchers, each contributing unique insights into the evolving landscape of pharmaceutical research. This will explore emerging technologies, sustainable drug development, novel delivery system, and interdisciplinary approaches that will define the next era of innovation. I hope this platform shall not only engage actively for exchange of the research ideas, but also forge long-lasting collaborations that transcend geographical and disciplinary boundaries. Let this conference not only inspire new research but also reaffirm our collective responsibility to ensure that science serves humanity ethically, equitably, and effectively. This conference shall mark a pivotal moment in our shared pursuit of innovation, collaboration, and advancement in pharmaceutical sciences. I appreciate the hard work of organizing committee, Dr. Sunil Jawala, Principal, and the whole team of the Gita Institute of Pharmacy who have made this event possible, and heartfelt thanks to IPA for such a wonderful collaboration. I assure that this conference shall be a resounding success and a beacon for future discoveries. My best wishes to all of you to derive maximum learning from the conference. Once again, I extend my hearty welcome to you all. Have a great conference. Thank you.
Thank you so much, sir, for your valuable words.
Leadership is not about titles or positions. It's about impact, influence, and inspiration.
We are fortunate to have such a great leader in our university, Pro Chancellor Sir Shri Nishant Bansalji. His support and progressive vision fuel our academic spirit and inspire us to keep giving our best. So I now invite respected Nishant Bansal Sir to share his thoughts and vision and enlighten the path for this intellectual journey. Give a huge round of applause.
Good afternoon, all of you. Javla sir की सबसे ज़्यादा आवाज़ है. Thank you very much. So it is a response actually, reciprocal. When I say good afternoon, there should be a response. Good afternoon. Good afternoon, everyone. Thank you very much. So most respectfully, today's chief guest, Professor Dr. Dipender Singh ji, and he is the chairman of the Education Regulation Committee, Pharmacy Council of India. With the core of my heart, I welcome you and honor you, sir, for sparing your valuable time and coming here to encourage us, encourage our students. We have among us Shri Mandeep Manji, Member Central Executive Council IPA and Honorary Secretary IPA, Haryana Branch. So I welcome you, sir, and honor you. Dr. Anurag Khatkar, President IPA Haryana Branch. Dr. Vineet Mittal, Vice President IPA Haryana Branch. Dr. Rohit Dutt, Vice President APTI Northern Region. So, and all the professors, associate professors, all the faculty, research scholars, all the students, those who are presenting their paper in this international conference, and most respectfully the resource person, those who will listen you for 2 days. So I welcome you all and honor you on this second international conference on, organized by Pharmacy, Department of Pharmacy. So I would like to tell you some few things about this Gita University to our chief guest and other guest. We started this university in 2022 and it is the youngest university of Haryana. And I feel pride to tell you that from the very first day, we implemented National Education Policy 2020 in our campus. It is not implemented, I will say we have successfully implemented this National Education Policy. And I was sitting with Shri Dipender ji, and I was discussing that we are implementing this CBCS system from very first day, and we are waiting the moment when the Pharmacy Council of India will implement this system, and we are already ready to implement this system in advance in our system. Other than this, we host last year PCI Pharma Innovation 2024 in our campus in Gita University, and I am happy to share you that this happened only with the help of Shri Dipender Singh ji. I came to know that this chance we got from the help of Shri Dipender Singh ji. So we thank you all, sir, for this support. And also I would like to tell you that in our Department of Pharmacy we are doing many good things. The result of that, we have more than 15 countries students in our Department of Pharmacy, those who are studying. We have signed MOU with many companies, and I will name some of the companies like Cipla, Sun Pharma, Mankind, True Worth Healthcare group of companies. And if I talk about the placement, there are a lot of companies, those are visiting for the placement of the students and for the internship of the students. Among them, we have Laborate Pharmaceutical, McLeod's, Sun Pharma, Cipla, Blessing Healthcare, IDS Infotech, and so on. And I also would like to tell you that the highest package we offered from this company is 8 lakh rupees this year. And dear students, because as our Vice Chancellor, Dr. Vikas Singh already told you that a lot of work is required, a lot of efforts is required to improve the system of pharmacy department, to improve the system of pharmacy in the country. because we are lacking in research, we are lacking in innovation. Because, you know, if I talk about 4 years back, 5 years back, because the system is changing now. 4 or 5 years back, our students are taking admission in pharmacy only to get placement, only to become a pharmacist, to open a shop. But now we have changed. This is our second international conference we are organizing. This is a step to enhance research in Gita University. And I request again Mr. Dr. Dipendra Singh ji to give us chance from the Pharmacy Council of India. Any duty or any responsibility you will assign us, we will perform that in a better way to enhance the research in the country. So there are a lot of things that we are doing. The number of list is there because the time is of 5 minutes. And in Gita University, other than this pharmacy department, we are running computer science department, we are running management departments, nutrition dietetics, agriculture, computer science department. So in all the departments we are implementing NEP, and the result of NEP that our students are more active than in any other university. This is a very young university. We are in the 3rd year of the university, and you will see the results after 1 year, the placement after 1 year. And I am assured that our students are doing excellence, and they will do excellence in all the departments, in all the fields. So I once again congratulate the Department of Pharmacy, Gita Institute of Pharmacy, Dr. Javla and his team, Vice Chancellor Dr. Vikas Singh, Pro Vice Chancellor Dr. Gulshan Chauhan and their team for organizing such wonderful conference, and I wish you all the best for this 2 days event. And I ensure that the students, the participants, all the professors, those who are coming have already approached from different colleges. They will enjoy our hospitality also for these 2 days. Thank you very much.
Thank you so much, sir, for your motivational words.
Someone has rightly said,
Knowledge is the eternal flame that dispels the darkness of ignorance. We are deeply honored to welcome our distinguished chief guest, Dr. Dipendra Singh, Chairman of Education Regulation Committee, Pharmacy Council of India. Dr. Singh brings an impressive more than 17 years of professional experience, including 12 years in research and 16 years in teaching. He has held the notable academic positions such as Reader at Rumtanga College of Pharmaceutical Science and Research, Billai, and lecturer at Pandit Ravi Shankar Shukla University, Raipur, and B.R. Nahata College of Pharmacy, Mandsaur. Dr. Singh has a valuable industry experience also, having worked as a management trainee officer at Universal Medicare Limited in Mumbai. In addition to his academic contributions, Dr. Singh has demonstrated outstanding leadership in administrative role, having served as the head of Rumtanga College of Pharmaceutical Science and Research, as a member of the Board of Studies from 2008 to 2011. Furthermore, he has more actively involved in the Departmental Research Committee and the University Anti-Ragging Committee. We are truly honored to have Dr. Singh with us today to share his valuable insight. Please join us in extending a warm welcome to Dr. Dipendra Singh. Please join your hands for a thunderous applause.
Thank you so much for introducing me to the audience. A very warm good afternoon to all of you. Honorable Pro Chancellor Shri Nishant Bansal ji, most respectful and honorable Vice Chancellor of this university, Professor Vikas Singh Sahab, Honorable Pro Vice Chancellor Dr. Gulshan Chauhan ji, a very dynamic administrator from Haryana, Shri Mandeep Manji, my friend, personal friend and colleague, Dr. Anurag Khatkar. The reason because of whom I am here, my friend Dr. Rohit Dutt, and I am very fair to share with you all that he is the key person who brought me here due to I was very much engaged due to my personal reasons and there is some very important issues which are going in my university. But apart from that, even he has not invited me, he instructed me, you have to come to this place, and I am here. But actually, to be very fair, I enjoy visiting and meeting my students and sharing with them that what we are doing new to the students and what we are coming, with what we are coming to them and what we are thinking about the future of pharmacy, where we are targeting. So thank you, Dr. Rohit, for giving me opportunity to interact with very beautiful university, a very humble management and very enthusiastic students. Principal of this institute, Dr. Sunil, always smiling, energetic. So thank you for interacting with me and continuously following me. Dr. Vineet Mittal, Dr. Sarita, Dr. Ritu, those who are present in the house. Professor Bhatt has joined us, and Dr. Mukesh, he is heading a research institute. So that we are having a galaxy of people who will be interacting with you. Friends, I always start my talk that we are living in the era of change, and this is a very changing time. Because if you'll see few months back, or 5, 6, 8 months I'll say back, people were talking about ChatGPT. It is coming, it will come, it will change the scenario of every field. And now in everybody's hand we are having this technology and we are playing with AI. कितने लोग हैं जिनके फोन में ChatGPT है? Almost all. And it is now, if I'll share what is the beauty of this AI, you all are aware. But at the same time, why I am discussing, we are having a very wonderful conference with a topic that we have to deal with the frontiers in the pharmaceutical research, what we are having. But I am starting with this I am initiating this talk because there we are finding that just I am sharing a very small story because we are already late and I am having a lot of things to share with you all. I am sharing you a very small story. एक मेरे दोस्त हैं जो मेरे साथ मॉर्निंग वॉक करते हैं और वो साइंस से नहीं है. उनका एक बहुत जेन्युइन सा क्वेश्चन था मुझसे कि आपको ऐसा क्यों लगता है, आपको ऐसा लगता है कि एआई आने के बाद में चीज़ें बहुत इम्प्रूव हो जाएंगी और ये पॉजिटिव है नेगेटिव है. तो मैंने उसके पॉजिटिव साइड पे उनके बात किया कि नो, इट विल इंक्रीज द इफेक्टिविटी, हमारा एफिशिएंसी को इंक्रीज करेगी. सब काफ़ी बात हुई. फिर थोड़ी देर बाद उन्होंने बोला कि कहीं ऐसा तो नहीं होगा जैसे कैलकुलेटर आया और हमने कैलकुलेशन बंद कर दिया तो आपका एआई आने के बाद में आप लोग सोचना ही बंद कर दो. बिकॉज ही विल थिंक अबाउट the things, and now I'm observing that we are doing like that, blindly we are doing like that. So friends, this is a very high time, specifically to the student I am sharing with you all, that this is the high time that you should use the technology very judiciously. How you are using it, either we are working as a slave of this technology or we are the master of this technology. So I'm requesting you all that use it as a tool, not it is a master of yours. Because you are dictated and it is technology always dominate. और मुझे बिल्कुल बताते हुए आपको एक अपने साथ की प्रॉब्लम बता रहा हूँ मैं. When I was writing with the paper and pen, then I have to think about the spellings, I have to think about the sentences. पर जब से मैंने कंप्यूटर पर टाइप करना स्टार्ट किया, मुझे कुछ नहीं सोचना पड़ता है. मैं गलतियां करता हूँ, वो सुधारता रहता है और मुझे उस गलती के बारे में सोचने की भी जरूरत नहीं है. विद द टाइम मैंने कभी एक बार रियलाइज किया कि मेरे पास सिस्टम नहीं था और मुझे एक लेटर लिखना था. तो then I was struggling कि मुझे हर बार उसकी आदत थी और हर बार मैं मिस्टेक करता था, वो सुधार लेता था, मुझे कोई जरूरत नहीं. तो then I realized and then I changed my habit कि maybe I have to write. I am having a soft copy, I am having the computer, but I prefer writing on a paper, then I used to type it. So then you are making yourself very that is relevant on what you are thinking. Again, I am sharing a very small, this is a research studies why I am telling you. There are two group of people made. One group was provided with the AI and all the tools, and another group was only provided with the internet facility of searching. That they can search from the internet, they can take their literature, everything. When they ended with the project, the people who have given the AI, their project was very good. The people who worked with the Google, they also done good, but they were not equivalent to the people who were working with the AI. But after that, the second phase, when it was the issue was of the implementation and related problems with that project, then the people who worked with the AI, they failed. And the people who worked with the Google and they searched, they taken the literature, they were very fluent about the project, they were very thorough about the project, and the derived things what they have done very good. So what is why I am sharing with you, when you are making effort, when you are reading the things, when you are knowing the things, then definitely the implementation will be far better than the people who are making doing the things with the technology. So this is a very thin line that either you are dominated or you are dominating. So we have to dominate the technology. हमको कहाँ कैसे यूज करना है ये आपको बहुत सोच के करना पड़ेगा. ये नहीं है. और एक उनकी फ्रेंड की एक और अच्छी बात थी कि मैंने उनको एक बात बोली थी कि ये टेक्नोलॉजी आने के बाद हमारा बहुत समय बचेगा, हम अच्छा काम करेंगे. तो उन्होंने मुस्कुराते हुए पूछा कि बचा हुआ समय का क्या करेंगे. तो मैंने अभी देखा है कि आप लास्ट टाइम तक अपने समय को, आपका फोन आपका सबसे अच्छा दोस्त है आजकल, तो हम पूरा समय तो उसको देते ही, उस पर ही मैं बात करूंगा. तो वो समय हम कहाँ यूज कर रहे हैं. So that is also very important. कि when you are saving your time, so where you are utilizing it, how you are improving, how you are using it for your improvement, that is very important. Friends, there are so many things. अभी प्रो चांसलर साहब ने भी, बंसल जी ने भी मुझसे बात करी. There is again just I am representing Pharmacy Council of India, so I am sharing with you all that council is coming. This is a very new council in a new color. Initially, people has to visit to the council to take the things or to give their messages or to transmit anything or to take any information from them. But right now, council is moving to everybody. We are moving to every place. We are taking your problems. We are giving the solutions. So this is a new council, and we are coming with so many new schemes. जैसा हमसे एक्सपेक्ट कर रहे हैं, मैं आप लोग से शेयर कर रहा हूँ. बहुत बच्चे आप लोग अभी फाइनल ईयर में, those will go for the PG studies. Again, the council has started a full scholarship for the students who will qualify GPET examinations. So full scholarship will be provided by the Pharmacy Council of India. We are coming for all the stakeholders. We are coming with the schemes. For the teachers and the researchers, we are coming with a new scheme that is called Research Development Scheme. That will be funding the projects, and more than 2 crore budget is already allocated for that, for this project and schemes. We are also coming with for the students, those who are pursuing, because we are talking about innovation, we are talking about the ideas, and I'll come to the Professor Vikas point, what is the issue with that. That we are coming with the doctoral fellowship, the people who are pursuing doctoral fellowship and they want to do good in the research, again council is going to support them, and we are coming with this scheme for the doctoral scholarship. Then again, another very ambitious scheme we are coming, that is the capacity building in industrial training. It is called CBIT. There we are selecting the teachers from the institutions, and we are sponsoring them for 1 month training to the industries. We are mediating, we are giving them opportunity to work in the industry, and they will go, they will train themselves at that place, and they will come to their institution, and then they will teach their students, because it is always, we have seen that those who are in academics, they lack the industrial experience and exposure, what practically it is going there. तो वो वहां से जो सीख के आएंगे वो अपने बच्चों को कहीं ज्यादा अच्छे से बता पाएंगे. इसके लिए भी हमने अभी 100 टीचर्स का जो एक बैच है, उसके लिए जो पूरा फंड है 1 महीने के लिए, अप्रॉक्स 50,000 सपोर्ट इज गिवन टू द ईच टीचर फॉर अटेंडिंग दिस training program. And we are also mediating, we are giving the industries, we are providing the list of industries who are accepting them for this type of training. We are also coming with CEP, that is continuation of continuing education program. This is again a scheme for improvement of the knowledge and upliftment of the skills. Refresher courses for the pharmacists, which we have given to the state pharmacy councils, because state pharmacy councils are also a very integral part of our council, and there we are having a very large number of people who are associated with the state pharmacy council. So we are also giving fund to them for the your research that is for refresher courses on specifically related to pharmacy. This is again a very ambitious project. We are having a skill development center. We are coming with the Center for Excellence by the name of Skill Development Center, and a very handsome amount, that is more than 3 to 5 crore rupees, we are giving to the institution to make a Center for Excellence, which will be mentored by industry. They will train your people in the industrial provisions and what practically they are doing, and we will make a model there we can train our students, because biggest problem everybody talks about that we are lacking, जो सबसे जो सर अभी विकास सर भी बोल रहे थे, हम इंडस्ट्रीज के पास में ट्रेनिंग कर नहीं पाते क्योंकि हमारे जो बच्चों का नंबर है, because I am sharing, because number is the issue. We are working in the quality is no issue. We are trying to work in the quality. जो efforts है, जब मैं पढ़ रहा था तब भी ये बात हो रही थी कि इंडस्ट्री और एकेडमिया में गैप है. आज मैं इस पोजीशन पे हूं, मैं फिर भी बात कर रहा हूं कि इंडस्ट्री और एकेडमिया में गैप है. ये गैप ऐसा नहीं कि इस पे काम नहीं हो रहा है, इस पे हमने लगातार काम किया, गैप बहुत कम हुआ, लेकिन उसके साथ साथ हमारा नंबर भी बढ़ा, जिसके कारण यहाँ को गैप हमेशा दिखता रहता है. तो हम ये किसी को ब्लेम नहीं कर रहे हैं. जब मैं पढ़ रहा था तो जो कॉलेजेस की नंबर थी, इट वाज लेस देन 500 or 600. When I joined the council, the number was around 3000, and now in a tenure of 5 years, the number of colleges is 6000. So you can you estimate what the number is increasing in a way. So that in that way the gap is there. और हम गैप को कम करने के लिए, जो हमारे बच्चों का नंबर इतना ज्यादा है, तो आप इंडस्ट्रीज कितने बच्चों को सपोर्ट करेंगे, फिर मल्टीप्लाई द नंबर ऑफ स्टूडेंट, नंबर इज वेरी हाई. So that was thought कि how to take the things or how to give the exposure to the students. So we came with this scheme that we are pursuing, that if any institution is giving the infrastructure, they are associating an industry with them, they are making a model training centers for the their student and teachers. So we are supporting them, we are giving them 3 to 5 crore rupees to them to make a center, and that will be a continuous training center. Industry people will come, they will train you, they will teach you, and then you will have a self-sufficient staff who will give training to everybody who will come to your place. So that is, we are trying to start at least one training center in each state. So very soon it will be started and it will be live. Then another scheme is a professional development fund, in which we are giving fund to the teachers and to the other professionals for their development in terms of organizing seminar, workshops, foreign visits, travel grants, everything will be covered under that. And a provision of almost 200 crores is already done in the budget for these schemes, what I am telling you. So this is already done, and very soon it will be live on the website, and you will be eligible to apply online on that. So this is some few initiatives what we are taking from Pharmacy Council of India. Friends, as Dr. Vikas was very much worried about the value, about he was talking about the value, but though I am very happy with how we are performing it, because once if you are underlined with any problem, that makes an opportunity. अगर सर हमको कोई हमारी कमी, हमको प्रॉब्लम बता रहे हैं, तो आपके लिए एक अपॉर्चुनिटी है कि हमने वहां पे काम नहीं किया, हमको उस डायरेक्शन में काम करना है. एंड नाउ वी आर टॉकिंग अबाउट, वी हैव वर्कड ऑन द टेक्नोलॉजी, वी आर मेकिंग, आपको पता नहीं यूएस एफडीए मान साहब बैठे हुए यहाँ पे, यूएस के बाद में सबसे ज्यादा यूएस एफडीए अप्रूव्ड प्लांट्स हैं वो इंडिया में. इफ यू टॉक अबाउट द नंबर, वी आर हैविंग, बिकॉज इट इज सेड कि मे बी एनीबडी विल डिस्कवर वैक्सीन बट दे हैव टू कम थ्रू द डोर ऑफ इंडिया. मतलब बनाए कोई भी, डिस्कवर कोई भी करे, लेकिन बनाना आपको हमारे पास पड़ेगा क्योंकि हमारे पास कैपेसिटी है. बट अगेन एट द सेम टाइम वी हैव टू वर्क ऑन इनोवेशंस. हमको न्यू डिस्कवरीज पे काम करनी है. वी आर हैविंग ए फैसिलिटी ऑफ प्रोडक्शन. नाउ वी आर रिक्वायरिंग सच प्रोडक्ट्स, ग्राउंड ब्रेकिंग प्रोडक्ट्स, क्योंकि एक भी ब्लॉकबस्टर प्रोजेक्ट अगर आप प्रोडक्ट देते हैं तो आपकी पूरी कंट्री का सीन बदल देता है वो एक डिस्कवरी से. So now this is the time that we should work on innovation. And that is I am narrating with, I am talking to you, you are budding pharmacists, you are new pharmacists. देखिए हमारे दिमाग में हर दिन कोई ना कोई नया आइडिया आता है. आप सब फेसबुक देख रहे हैं, रील देखते हो कि नहीं देखते? ना बोलोगे पर देखते तो होगे, दिन भर वही घुमाते हैं. So when you will start scrolling, you will find so many innovative products of China. आप देखोगे हमको सोफा अगर हटाना है तो कोई एक गैजेट बना दिया उनने, उंगली नहीं कटे सब्जी काटते समय एक गैजेट बना दिया उनने. तो क्या ऐसे आइडिया आपके दिमाग में नहीं आए होंगे? सबके दिमाग में आता है, हर समय आता है, लेकिन हम अपने आइडियाज को कभी नोट नहीं करते, उसको कैपिटलाइज नहीं करते. तो दिस इज ऑल इनोवेशन. आई एम टेलिंग यू, माय ब्रदर इज हैविंग अ हॉस्पिटल, वी वर डिस्कसिंग. मैं बता रहा हूँ कि कैसे इनोवेशन होते हैं, कैसे पेटेंट होते हैं, कैसे यूटिलिटी होती है. मैं उनके साथ बैठा था तो वो बोले कि हमारे यहाँ बहुत कॉमन एक्सीडेंट्स होते हैं कि तो जो वायल्स हैं लाइक जो हॉस्पिटल में जो ओटी में यूज होते हैं वो वायल्स छोटे रहते हैं, उस पे जो स्क्रिप्ट्स रहते हैं वो भी बहुत छोटा रहता है और उनके नॉर्मली कलर कोड रहते हैं जिससे वो फास्टली वो उसको आइडेंटिफाई करते हैं. लेकिन कभी कभी बहुत बार जब बहुत अगर वो इमरजेंसी में करते रहते हैं, हेज में करते रहते हैं, तो उससे मिस्टेक्स होते हैं उनसे, उनको वायल उठाने में ड्रग्स के. तो वी सेड कि इट इज अ वेरी सिंपल, बिकॉज दे वर हैविंग ए ट्रे. हमने एक बहुत सिंपल सा इनोवेशन किया कि हमने उनके ट्रे के ऊपर में एक मैग्नीफायर लगा दिया. मैग्नीफायर के नीचे जो ड्रग था उसको हमने कलर कोड भी कर दिया कि अगर उस कलर कोड पे पर्पल कलर पे अगर पर्पल कलर का अगर वायल नहीं रखा हुआ तो आपको दूर से दिख जाएगा कि वायल कोई दूसरा रखा हुआ. सो दिस इज वेरी सिंपल बट दिस इज वेरी इंपॉर्टेंट, अ लाइफ सेविंग. एक गलत ड्रग किसी को लग गया तो वो उसके लिए प्रॉब्लम, उसकी लाइफ चली जाएगी. तो दिस आई एम टेलिंग यू, दिस इज ऑल इनोवेशन, दिस इज न्यू थिंग्स. हम हर दिन ऐसा चीज हमारे दिमाग में आता है लेकिन हम उसको सोचते हैं कि हमारे आइडिया की कोई वैल्यू नहीं है. नो, एवरी आइडिया इज वैल्यू, हैविंग ए वैल्यू. आप बहुत इंपॉर्टेंट है. देखो सबसे आई वाज जस्ट डिस्कसिंग फ्रॉम एवरी स्टेज, आई एम टेलिंग यू कि इनिशियली वी वर फाइटिंग फॉर द एग्जिस्टेंस. अगर फार्मासिस्ट को देखेंगे तो वी आर ट्राइंग टू बी पार्ट ऑफ द हेल्थ केयर सिस्टम. हम चाहते थे कि हम हेल्थ केयर सिस्टम का बहुत इंटीग्रल पार्ट बने, लोग हमको मेडिकल प्रोफेशनल समझें. और बहुत सारे बच्चे तो हमारे एप्रन पहन के इसलिए घूमते. मैंने एक बार पूछा बच्चों से कि तुम लैब के बाहर लैब कोट पहन के क्यों घूम रहे? बोले सर अच्छा लगता है, डॉक्टर जैसा लगता है. सो दिस इज द फीलिंग व्हाई आई एम शेयरिंग यू वेयर वी आर ट्राइंग टू बी अ पार्ट ऑफ हेल्थ केयर सिस्टम. ओके फाइन, लेकिन आप ये सोचिए कि जिसके जैसा आपको बनना है तो व्हाई वी आर हैविंग रेस्पेक्ट फॉर देम. Now we are not fighting for the existence. After COVID, everybody knows who are pharmacists, how they have helped everybody. Now we are fighting for respect. And respect is never demanded, it is always commanded. और ये respect के लिए बहुत simple सा मंत्र है कि you should be very knowledgeable in your subject. What the skill which is required from you, you should be very thorough in it. What the information and knowledge which is required from you, you should be very thorough in it. और ये बहुत simple है कि जो, और ये सिंपल मैं सिर्फ नहीं बोल रहा हूं, ये करना है, करने का तरीका ही बहुत सिंपल है. जो आपके क्लास में पढ़ाया जाता है, जो आपके प्रैक्टिकल्स में कराया जाता है, अगर आप उतना काम भी बहुत सिंसियरली कर रहे हैं तो आप अपने नॉलेज में अपडेटेड रहेंगे, आपका नॉलेज बहुत अच्छा रहेगा और आप इतनी गट्स रखेंगे चैलेंज करने की. कोई डॉक्टर अगर गलत प्रिस्क्रिप्शन लिखता है तो आप उसको बोलने का हिम्मत रखेंगे कि आपके प्रिस्क्रिप्शन में गलती, इसको सुधारिए. राइट नाउ नोबडी इज हैविंग गट्स टू चैलेंज ए डॉक्टर्स प्रिस्क्रिप्शन. व्हाई? Because you are not sure that what you are knowing it is right or wrong. हम कई बार हमको पता भी रहता तब भी हम इतनी हिम्मत नहीं जुटा पाते हैं कि हम उनको बोलें. क्यों? क्योंकि आप कॉन्फिडेंट नहीं है. और आप कॉन्फिडेंट क्यों नहीं है? क्योंकि आपको अपना सब्जेक्ट का नॉलेज जो रिक्वायर्ड है वो नॉलेज नहीं है. So there we are having a problem. Yesterday I was in a meeting and the chairman was president of Panacea Biotech, Dr. Rajesh Jain, and he was saying कि we are in search of very good people who are skilled and we are waiting for them. And I was saying कि my students are searching for the opportunity and we are not getting the opportunity. So just the problem is very simple. वो उनको एक लायक लोग चाहिए और उनको लायक लोग नहीं मिल रहे हैं. हमको एक अच्छा काम करने के लिए अच्छी इंडस्ट्री चाहिए, आपको इंडस्ट्री नहीं मिल रही. प्रॉब्लम क्या है? जो स्किल सेट और नॉलेज उनको रिक्वायर्ड है वो आप लेके नहीं जा रहे. तो हमारा गैप खत्म हो गया. अगर आप जो पढ़ रहे हैं, जो आपकी क्लासेस चल रही हैं, जो प्रैक्टिकल चल रहा है, अगर आप उसको बहुत ईमानदारी से करते हैं तो आपको कोई कहीं नहीं रोक सकता. दिस इज द टाइम. और ये बहुत छोटी सी बात है, बहुत सिंपल बात है. बोली इसमें क्या स्पेशल है? नथिंग इज स्पेशल. यही स्पेशल अगर आप ये करते हो. जस्ट अ वेरी स्मॉल स्टोरी आई एम टेलिंग यू. मैं बहुत, मुझे कोई इसमें शर्मिंदगी नहीं है कि आई ट्राइड फॉर मेडिकल. मैंने एमबीबीएस के लिए ट्राई किया, मेरा सिलेक्शन नहीं हुआ था. ओके फाइन. लेकिन मैंने डिसाइड किया कि मैं जिस फील्ड में काम करूंगा उसमें ही सबसे अच्छा काम करूंगा. सो आई ऑप्टेड फार्मेसी एंड आई started working very hard for it. तो मेरा चूंकि सिलेक्शन नहीं हुआ था, तो मैं जब एक ट्रेन में ट्रैवल कर रहा था, एक बच्चा मेरे बगल में बैठा हुआ था, तो मैंने बोला तुम्हारा चेहरा बहुत देखा देखा सा लगता है। तो उसने बोला हाँ सर, मेरा अभी पेपर में फोटो छपा था। मैंने क्यों? बोले सर मैंने मेडिकल के टेस्ट में टॉप किया। तो ऑब्वियसली कोई टॉप किया जिसमें आप सेलेक्ट नहीं, आप सोचते हो कि उनसे बात करें। तो मैंने उनसे पूछा तुमने क्या तैयारी करी थी, कैसे तैयारी करी थी तुमने? तो उसकी बात मैं हर जगह पे बोलता हूँ। उसने मुझसे बोला कि सर मेरे पास 3 बुक थी, फिजिक्स, केमिस्ट्री और बायोलॉजी की, और उसने एक पब्लिकेशन का नाम लिया, दैट वाज अ वेरी मीडियोकर पब्लिकेशन, कोई बहुत स्टैंडर्ड फॉरेन का पब्लिकेशन नहीं था, पर उसने ये कहा कि ये मेरी 3 किताबें मुझे बहुत अच्छे से आती हैं, इसका कुछ भी छूटा हुआ नहीं है। आप मेरी जो किताबें हैं, जो इसमें इंफॉर्मेशन हो, मुझे ये किताब ही पूरी आती है, मैं इसके अलावा मैंने कुछ रिफर नहीं किया। तो पॉइंट ये है कि कहीं हम बहुत अच्छे की सर्च में ये अच्छा मिल जाएगा, अच्छा लिटरेचर मिल जाएगा, अच्छे टीचर मिल जाएंगे, अच्छा कॉलेज मिल जाएगा, उसके सर्च में जो आपके पास एग्जिस्टिंग है उसको आप छोड़ देते हो। सो सबसे पहला डिसीजन ये कि सबसे बेस्ट यूनिवर्सिटी में आप पढ़ रहे हो, ये आपका बेस्ट यूनिवर्सिटी है। सबसे अच्छे टीचर आपको पढ़ा रहे हैं, वही सबसे अच्छे टीचर हैं जो आपको पढ़ा रहे हैं। जो आपके पास बुक्स है, जो लाइब्रेरी में आपको बुक्स अवेलेबल है, वो सबसे अच्छी किताब है आपको पढ़ रहे हैं, क्योंकि द इंफॉर्मेशन व्हाट इट इज, अगर मैं पूछूंगा जो वो है वो आपने पढ़ लिया क्या, बोले नहीं हमको अच्छे का सर्च, हमने ये नहीं पढ़ा। So we are in search of good. So this is the biggest problem. So what the time you are having, the best time you are having, what the institution you are having, this is the best institution. What the teacher you are having, they are the best teacher who are teaching you. अगर जैसे ही आप ये बात दिमाग में लाएंगे तो आप अपनी जिंदगी में कहीं ना कहीं बहुत अच्छा करेंगे, और ये आपको बहुत गौरव दिलाएगा। फ्रेंड्स, वी आर कमिंग, 2-3 बातें जल्दी मैं करके खत्म करता हूं, क्योंकि ऑलरेडी वी आर लेट. We are coming with new syllabus of pharmacy, and there will be a 360-degree change in the pharmacy curriculum. अभी साहब प्रो वाइस चांसलर साहब कह रहे थे कि न्यू सिलेबस NEP 2020 के बारे में बात कर रहे थे. सो वी आर कमिंग विद अ वेरी न्यू सिलेबस विद स्पेशलाइजेशन. द सिलेबस विल बी 4 सेमेस्टर जो है उनके कोर सब्जेक्ट्स हैं कांस्टेंट रहेंगे, एंड नेक्स्ट 2 जो सेमेस्टर्स हैं, जो 4 सेमेस्टर्स हैं, they will be towards the specialization. Though people can have an option of opting syllabus, they can opt to the industrial pharmacy, they can opt to the clinical and hospital pharmacy also. So there we are coming, this is on experimental basis, we are coming with 2 specialization. If we will be successful, we will come with the further more specialization in that. So there you will have, the student will have liberty to choose their subject. There will be a basket of subjects from where you can choose कि आपको क्या पढ़ना है, आप उसमें से अपना सिलेक्शन कर सकते हो जो आपके सब्जेक्ट्स हैं. सो दैट विल लीड टू स्पेशलाइजेशन, बिकॉज जब हम इंडस्ट्री में बात करते हैं तो आप वहां स्पेशलाइज नहीं है. तो हमारा यहाँ पे इंटरेस्ट ये है कि आप 2 साल जो कोर सब्जेक्ट्स हैं, वो कोर फार्मेसी के सब्जेक्ट आप पूरे पढ़ेंगे, लेकिन जो अगले 2 साल रहेंगे, अगर आपको इंडस्ट्री जाना आपने डिसाइड कर लिया कि नो आई हैव टू गो टू द इंडस्ट्री, देन यू विल select your subjects from that basket. That will lead to a very skilled manpower who will be industry ready. So that will be increase the chances of employability in your industry. That is one issue. Those who have decided we will go to the clinical, we will go to the research, we will go to the hospital, then they can opt subjects like that. So they will be having a skill set in that direction. Also, we are coming with plain B Pharm. These will be the B Pharm major in clinical pharmacy, hospital pharmacy, B Pharm major in the industrial pharmacy, and there will be a plain B Pharm also. क्योंकि हमारा देश जो है एक बहुत बड़ा देश है, और जहाँ पे आप इतनी सोफिस्टिकेटेड और बहुत अच्छे हॉल में बैठे हैं, आपकी गीता यूनिवर्सिटी बहुत अच्छी यूनिवर्सिटी है, फैसिलिटीज आपके पास बहुत हैं, पर हमारे पास बहुत सारे ऐसे जगह भी हैं जहाँ पे उनको फैसिलिटीज नहीं है. सो दे आर लैकिंग मैन पावर, टीचिंग मैन पावर, बहुत सारे रिसोर्सेज है. तो वी आर ऑल्सो कमिंग विद अ प्लेन बी फॉर्म विच विल हैव अ व्हाट द टाइप ऑफ सिलेबस. वी आर हैविंग अ सिलेबस ऑफ अ वेरी अपडेटेड सिलेबस फॉर देम ऑल्सो, and there we are also having a liberty for the university. The student will have a choice. University will have a liberty of 20%, more than 20%, according to their need. They can select the subjects, or they can, with the prior approval of the council, they can change up to 20%. They can change their syllabus. Online platforms, online MOOC courses, SWAM from the SWAM portal. There are again we are giving option to the student. If you have to reach out your credits with that, you can select from that paper from that area also. So there will be a 360-degree change. Technology will be part of that. Very new technologies are coming. we have to struggle with because pharmacist has to struggle with the machines. I don't know you people are knowing or not, but in so many countries now we are having robotic pharmacists. They are robots and they can dispense in minutes, they can dispense thousands of prescriptions. So then again you will be having a challenge. तो मुझसे किसी ने पूछा था कि सर अगर ये मशीन से अगर काम करने लग जाएंगी तो हम मतलब हमारा क्या होने वाला है? तो मेरा आंसर अभी भी वही है कि मशीन में कभी भी कॉन्शियसनेस नहीं रहती है, लर्निंग कैपेसिटी नहीं रहती, आपके अंदर रहती है और आप हमेशा मशीन को डोमिनेट इस बात पे कर सकते हो कि मशीन उस दिन के बाद अगले दिन नहीं सीखता है, जिस दिन तक की एक्सपीरियंस आप उसको डालते हैं उस दिन तक वो सीखा हुआ रहता है, उसके बाद हम हर दिन सीखते हैं, तो हम हर दिन उनसे प्लस रहते हैं, हर दिन आपका उनके ऊपर प्लस रहता है, तो मशीन कभी भी आपको डोमिनेट नहीं कर सकती है अगर आप मशीन को टूल जैसा यूज कर रहे हैं तो. सो दैट इज अबाउट द सिलेबस. Again friends, I want to conclude my talk with you. मैं हमेशा 5 बातें बोलता था, आज गीता यूनिवर्सिटी में एक नई 6वीं बात ऐड कर रहा हूं, वो मैं आपसे शेयर करूंगा. सबसे पहली बात, ऑलवेज रेस्पेक्ट योर पेरेंट्स एंड टीचर्स. ऑलवेज रेस्पेक्ट. ये जैसे मैंने एक बात बोला तो मेरे स्टेज पे ही मेरे कलीग थे, उन्होंने मुझे बोला कि इसमें नई बात क्या है, आप ये क्या बात सिखा रहे हो कि टीचर्स और पेरेंट्स का रेस्पेक्ट करना चाहिए. तो मैंने कहा कि नहीं, एग्जिस्टिंग टाइम में अगेन व्हेन वी आर टॉकिंग अबाउट एआई, तो नाउ द स्टूडेंट्स आर जजिंग देयर टीचर बाय चेकिंग विद द एआई. नो, यू नेवर जज देम बिकॉज दे आर हैविंग ए वास्ट एक्सपीरियंस, दे आर हैविंग एक्सपोजर. मैं बोल रहा हूँ जो मैंने बोला ना, हर दिन की लर्निंग कैपेसिटी है, तो अगर आप 18 साल के हैं तो आपने 18 साल लर्न किया, वो 36 साल के उन्होंने 36 साल लर्न किया, तो दे आर 18 years plus with you. So they are having a lot of experience and that experience they are contributing for you, not for themselves. पूरी पृथ्वी पे सिर्फ 2 लोग ऐसे होते हैं जो आपसे हार के खुश होते हैं, एक आपका टीचर, दूसरे आपके माँ बाप. इसके अलावा थ्री इडियट का कहानी तो पता है कि दोस्त लोग को तो कितनी परेशानी रहती है. तो मैं इसलिए कह रहा हूं कि आप कभी भी कितनी भी तरक्की कर लें, कई बार आप बहुत पढ़ लिख लेंगे, आप अच्छे जगह पे पहुंच जाएंगे, अपने टीचर से भी अच्छा कर लेंगे, लेकिन आपको उनका रिस्पेक्ट हमेशा करना चाहिए. उनका आशीर्वाद हमेशा आपको कहीं ना कहीं अच्छी जगह पे ले जाएगा. आपने सचिन तेंदुलकर को देखा होगा कि सचिन तेंदुलकर के साथ में उनके जो कोच थे उन्होंने कभी क्रिकेट नहीं खेला, लेकिन आचरेकर जी का नाम सब जानते हैं कि ही वॉज हिज कोच इनिशियली. ही वो क्यों करा? क्योंकि सचिन तेंदुलकर ने हर जगह उनको रेस्पेक्ट किया कि ही इज माई टीचर, और उससे उनका मान बढ़ा, कम नहीं हुआ. सो दैट इज द रीजन दैट यू ऑलवेज रेस्पेक्ट योर एल्डर्स, टीचर्स एंड योर पेरेंट्स. चाहे आप कितने ही बड़े हो जाएं, उनका रेस्पेक्ट नहीं छोड़े. ये मेरी पहली बात है. और जो मैं ये बातें बोल रहा हूं, अगर ये आप लाइफ में इंप्लीमेंट करेंगे तो आपकी लाइफ बदलती हुई दिखेगी. आप फर्स्ट थिंग. देन सेकेंड थिंग इज से नो टू एनी टाइप ऑफ एडिक्शन. आई एम नॉट टॉकिंग अबाउट ड्रग, आई एम नॉट टॉकिंग अबाउट एल्कोहल, आई एम टॉकिंग अबाउट एडिक्शन. एंड द बिगेस्ट एडिक्शन नाउअडेज, मैं वो तो मानता ही नहीं कि उसका एडिक्शन होना चाहिए. द बिगेस्ट एडिक्शन व्हाट यू आर हैविंग इज योर फोन. बिगेस्ट एडिक्शन. सो नाउ यू हैव टू मेक नो फोन डे, नो फोन आवर. अगर आप ये कर पाएंगे तो कहीं ना कहीं आपका अपने ऊपर बहुत कंट्रोल हो जाएगा ये. और दैट इज वेरी इंपॉर्टेंट कि आप, बिकॉज व्हाई आई एम सेइंग यू, बिकॉज व्हेन आई वाज स्टडीइंग, जितने लोग यहाँ बैठे हैं जो अपने समय में पढ़ रहे थे, तो मेरा एक कैंपस था, मेरे बहुत सारे दोस्त थे, मेरा खेलने का टाइम था, मैं ग्राउंड में खेलने जाता था, मैं साइकिल चलाने जाता था, मैं अपने बच्चों के साथ जो हमारे क्लासमेट्स थे उनके घर जाता था, उनसे बात करता था, फैमिलीज एक दूसरे फैमिलीज में विजिट करती थी. आज आप हो, आपका फोन है, आप कमरे में, आपको खाना खाना है उससे ऑर्डर कर लो, आपको कपड़ा पहनना उससे ऑर्डर कर लो. लोग अब शादी भी फोन से कर ले रहे हैं. ठीक है, कि आपको अच्छा शादी देखना, उससे मिल गया, उससे सेलेक्ट करो, उसको मैसेज करो शादी. सो दिस इज द प्रॉब्लम वी आर हैविंग. सो यू हैव टू बी out of this addiction. और ये now this is a phobia. If I take your phone from you, you will start behaving differently. The reason, because you are addicted to it. आप जिनके बच्चे बड़े हो रहे होंगे, जिनके बच्चे जो यहाँ पे आप लोग बच्चे हैं, पर जिनके बच्चे बड़े हो रहे होंगे, वो जानते हैं कि if to my kid I am saying कि if I say him कि I'll take your phone, तो बोले मुझे खाना मत देना, लेकिन मैं फोन रहने दो आपने पास. This is the addiction what we are having. So you try to correct yourself. ट्राई टू मेक नो फोन आवर. ये धीरे धीरे हो जाता है कि आप, हमको ये पता है कि जब मैसेज आता है तो फोन पे एक बीप आती है, कोई साउंड आता है, लेकिन फिर भी साउंड नहीं है, लेकिन आप उठा के उसको 2 बार चेक करते हैं. व्हाट इज दिस? यू आर नोइंग देयर इज नथिंग बट यू विल चेक योर फोन. सो दैट इज द प्रॉब्लम वी आर हैविंग. You are not trying to talk to anybody. यहाँ पे भी बहुत सारे भी जो बैठे हुए हैं हमारे प्यारे बच्चे हैं, वो अभी भी फोन में लगे हुए हैं. बहुत सारे को मैंने देखा कि अभी भी अपने फोन पे लगे हुए हैं. So this is the time when the something is coming to you, opportunity is coming to you, you are not grabbing it, you are with your phone. और कब जिंदगी में आप ऐसी अपॉर्चुनिटी आप अपने फोन के साथ में खो देंगे आपको पता नहीं चलेगा. एक बहुत अच्छी अपॉर्चुनिटी आई थी और मैं अपने फोन के साथ था, आपने देखा नहीं उस अपॉर्चुनिटी को. So this is the problem. So start, say no to any type of addiction. This is the second thing. Third, do exercise for at least 45 minutes. Why I am telling you? Because we are pharmacists and we are dealing with the people who are suffering, who are having problem, who are diseased, they are frustrated. So हमको अगर ऐसे लोगों से डील करना है तो आपको फिजिकली और मेंटली बहुत हेल्दी होना पड़ेगा. क्योंकि आप खुद अगर परेशानी में हैं तो आप कोई परेशानी वाले आदमी को आप क्या काउंसलिंग करोगे और आपकी वो बात क्यों मानेगा. इसीलिए हमको बहुत फिट होना चाहिए. सिर्फ 45 मिनट्स, आई एम सेइंग ओनली 45 मिनट्स. गिव योरसेल्फ. आपको जो अच्छा लगता है, टहलना अच्छा लगता है, खेलना अच्छा लगता है, साइकिल चलाना अच्छा लगता है, योगा करना अच्छा लगता है, स्विमिंग करना, जो भी करना अच्छा लगता है, आप 45 मिनट्स सिर्फ अपने आप को दीजिए, फिटनेस पे दीजिए. देन यू विल फाइंड चेंज इन योरसेल्फ. एंड दैट इज फॉर टीचर्स एंड स्टूडेंट बोथ. फॉर बोथ ऑफ देम आई एम टेलिंग कि गिव 45 मिनट्स टू देमसेल्फ. हम 24 घंटे में शायद 45 मिनट भी अपने लिए नहीं निकाल पा रहे हैं. आप सोचिए हमारे लिए प्रॉब्लम है ये. सो गिव 45 मिनट्स टू योरसेल्फ फॉर अ हेल्दी और फिजिकली एंड मेंटली हेल्दी लाइफ. ठीक है, ये तीसरी बात थी. चौथा एक बहुत इंपॉर्टेंट बात है, प्लांट एटलीस्ट 1 ट्री इन अ ईयर. एवरी टाइम वी आर कंप्लेनिंग. आपको मालूम है अभी थोड़े दिन में पराली जलेगी, हमारा सांस लेने जैसा जगह नहीं बचेगा, हम सांस नहीं ले पाएंगे, पेपर में लिखा जाएगा. इफ आई आस्क यू व्हाट इज योर कंट्रीब्यूशन टू योर एनवायरनमेंट, आप क्या कर रहे हो? हम एवरी डे यू आर इंक्रीजिंग योर कार्बन फुटप्रिंट. आप अपने कार्बन प्रिंट्स आपको छोड़ रहे हैं. आप बाकी एनवायरनमेंट के लिए आप क्या करते हैं? मैं अगर पूछूंगा आप 18 साल तक आपने एनवायरनमेंट के लिए, नो आंसर कि मैंने क्या किया. तो अगर आप हर अपने साल एक प्लांट लगा रहे हैं तो शायद जब आप 50 साल के होंगे तो आप कोई पूछेगा कि आपने एनवायरनमेंट के लिए क्या किया, तो आप कॉन्फिडेंटली बोल सकते हो कि मैंने 30 पौधे लगाए, मैंने जितनी ऑक्सीजन कंज्यूम करी मैंने उतना रिटर्न कर दिया हमारा, मैंने अपनी तरफ से कोई भी एनवायरनमेंट को कोई हार्म नहीं पहुंचाया. सो प्लांट एटलीस्ट 1 ट्री और उसकी देखभाल कीजिए एंड यू विल फाइंड दैट ओके आई एम कंट्रीब्यूटिंग टू द. क्योंकि जैसा आपको ये एनवायरनमेंट मिला है आप भी अपने बच्चों के लिए कुछ तो अच्छा करके जाएंगे. सो इन व्हाट वे यू कैन कंट्रीब्यूट. दिस इज द सबसे छोटा रास्ता है जिससे आप उनको कंट्रीब्यूट कर सकते हैं, एक प्लांट को लगा के उसको ग्रो करना. सो दैट यू कैन ऑप्ट एंड दैट विल मेक अ चेंज. फोर्थ जो मैं जो बोल रहा था, एक नया बात मैंने आज बैठे बैठे मेरे दिमाग में आया, तो मैं 6वीं बात आज यहाँ गीता यूनिवर्सिटी में, ये 5 बातें मैं बहुत सारे स्टेज से बहुत सारे बच्चों को बोल चुका हूँ, रिक्वेस्ट कर चुका हूँ. 6वीं एक बात है, मैं 5वीं बात पे आ रहा हूँ. 5वीं इंपॉर्टेंट बात है कि व्हाट वी आर कंट्रीब्यूटिंग टू द सोसाइटी. तो टेक अ चैलेंज ऑफ मेकिंग पीपल इलिटरेट पीपल लिटरेट. एक जो अनपढ़ आदमी, सिर्फ एक आदमी को आप चैलेंज दो कि मैं पूरे जीवन में एटलीस्ट एक आदमी को जो अनपढ़ है उसको पढ़ा लिखा बनाऊंगा. मैं उनको अनपढ़ है तो उसको पढ़ना लिखना, उसको साइन करना सिखाऊंगा. एक आदमी का चैलेंज देना, सिर्फ एक आदमी. सो देन अगेन यू विल हैविंग अ कंट्रीब्यूशन टू योर सोसाइटी. कि अगर कोई पूछेगा आप क्या कर रहे हो तो बोलना मैंने कम से कम एक आदमी को तो पढ़ाया, वो आपने क्या किया. तो एटलीस्ट सिर्फ एक करना है. और अगर साल में आप एक कर रहे हो तो अगेन you will have a big data after 40-50 years कि मैंने 50 लोगों को पढ़ाया. That is an achievement I am having. So take this challenge and start working on it. Okay. And the last, the 6th thing, inculcate the habit of reading. Inculcate the habit of reading. That the learned people who are invited in this conference. They will contribute to your scientific knowledge, and you will have a very updated personality, or you will have a enhanced personality after this conference, specifically from the knowledge base. So once again, congratulations to all of you for organizing this conference. Jai Hind, Jai Bharat.
Thank you so much, sir, for your valuable time, and you have shared multiple important and updated schemes and information related to funds, guidelines, industrial training, habit of reading. We will definitely implement in our life, sir, under your guidance. Thank you so much for your valuable and inspiring words. Give a huge round of applause. Now I welcome Dr. Sumita Ma'am, Principal of PM College of Pharmacy from Sonipat. Give a huge round of applause for her. Now I would like to invite Dr. Amit Latter, sir, to hand over a sapling as a token of respect to Dr. Sumita Ma'am.
Thank you, sir. We are grateful to have Mr. Mandeep Mann, Member of Central Executive Council IPA and Honorable Secretary IPA and TCO Rohtak. He has served in many prestigious pharmaceutical companies like Ranbaxy Pharmaceuticals as Product Manager and Ozone Pharmaceuticals as Production Manager. He also worked as Production Head in Glucose Manufacturing Unit of Pandit BDS PGI MS Rohtak. Before joining the Food and Drug Administration as District Drug Collector Officer, he has served at various districts like Gurugram, Panipat, Rohtak, Kaithal, Jhajjar, Bhiwani and Jind. He was awarded 5 times by District Administration of various districts for his contribution in medical area. He was awarded 2 times by State Award in year 2020 for his significant contribution towards Beti Bachao Beti Padhao. Now I welcome Mr. Mandeep Mann sir on the podium. Please, sir.
Please, sir.
Please give a big round of applause.
Thank you so much.
Good afternoon, everyone. Distinguished guests on the stage and off the stage, dear students, first of all, I thank you for inviting me here on such a wonderful international conference on the topic that is New Frontiers in Pharmaceutical Research. You are lucky that you got an opportunity to interact with Dr. Dipender, who is the Chairman Education Regulation Committee. And you are also lucky that you got admission in such a prestigious university who are giving their 100% to uplift the pharmacy education. In our time, we were not so lucky. At that time, there were not so opportunities like today that you are getting. You will interact with the people of different diaspora, and different keynote speaker will interact with you, and you will learn a lot in this conference. So I hope that you will also implement this learning in your future endeavors. Dr. Dipender has touched all the aspects, and nothing much is left to tell you people. But I just want to tell you the basics of this conference, like what is the aspects of new frontiers, aspects of research in pharmaceuticals. So, first of all, one is the precision medicine. What does that mean? This aspect covers the genetic makeup and environment and lifestyle specific medicines. Like this is the research aspect where the large population on the basis of genetic makeup and other environmental and lifestyle basis we can research on the medicines and produce medicines on a specific diaspora and for the target specific medicines. So other one is the AI, artificial intelligence. So artificial intelligence also other speakers also told you about artificial intelligence is one of the most emerging field nowadays, and the information provided by the artificial intelligence we can utilize that in research also for making new medicines, and that would also cater to the need of present healthcare system, and such medicines will be more specific, targeted, and with having less side effects. So some of the other aspects are like gene therapy and immune therapy and nanotechnology. So these are different aspects of research today. So you will learn all these things from the different speakers, and I hope you will focus on all the speakers and what information they deliver to you. So I hope you will learn a lot from this conference, and the important crux is that all the speakers told you about that we are lacking in the research. So we are pharmacy of the world, but still we are lacking in research. We are not making new medicines, and we will be successful only when we will be able to make new products, research new products. So make a pledge from today that you will start from today onwards and think about it and do something in the field of research and make our country great, so that we can flourish all over the world, not in only the like pharmacy of the world. We also prepare new molecules and new products also. With these words, I want to thank you again to management and you guys also for inviting me to such a wonderful conference. Thank you.
Thank you so much, sir, for your valuable words.
We are deeply honored to welcome Dr. Anurag Khatkar sir, presently working as an associate professor at Department of Pharmaceutical Science, Maharishi Dayanand University, Rohtak. He has more than 17 years of teaching and about 15 years of research experience in pharmacy profession. He has authored several books and has more than 85 research.
Give a huge round of applause. Thank you so much, sir.
It's already much late. So very good afternoon to all. पक गए हैं सारे. So, respected Pro Chancellor, Shri Nishant Bansal ji, Honorable Vice Chancellor Professor Vikas Singh Ji, Pro Vice Chancellor of Gita University, Professor Gulshan Chauhan Ji, our chief guest of today's event, the most dynamic and inspiring personality of pharma profession, Dr. Dipender Singh Ji, who is Chairman ERC at Pharmacy Council of India, and we are fortunate that he is with us today at campus of Gita University. And he is really a role model, a good leader and pathfinder for many of us, in fact all of us. Then member IPA Central Council, very respected Shri Mandeep Manji, whose name is always associated with bright achievements in drug control department and have been awarded many times at state and central level. Professor Rohit Dutt sir, whom I may call as a brother, elder brother and a mentor as well, and presently he is principal at GNM College, Ambala. Professor Sunil Javla ji and his entire team of Pharmacy and Gita Institute of Pharmacy, and all the esteemed guests, students and participants and the members of teaching fraternity. So a warm welcome to all, and it's an honor and privilege to be here today amongst all of you as President IPA Haryana branch in this prestigious conference, second international conference on new frontiers of pharmaceutical research. The theme of this conference is very much in line with the profession of pharmaceutical sector. And our state, Haryana, has emerged as a significant hub of pharmaceutical activity encompassing manufacturing, research, education and all sectors of pharmacy profession. And our state is home to numerous pharmaceutical industries, research institutions, academic institutions and institutes, and we contributed significantly to the healthcare sector of the country. And the Haryana state branch of IPA has been actively working to foster collaboration, knowledge, professional development within the vibrant ecosystem of pharmacy. And we have organized various seminars, workshops, continuing education programs, celebrated pharmacy weeks with collaboration with various institutes to keep our member abreast to the latest advancement in the field. So today's conference on new frontiers in pharmaceutical research is particularly crucial as we stand at the cusp of groundbreaking discoveries and technological advancement. And we are, just like Dipender sir said, we are in an era of change, especially in the pharma sector. The integration of advanced AI technologies in drug discovery to identify the potential drug candidates, predict their properties, optimize their structures, and the use of high throughput screening, automation, and the pace of experimentation has been accelerated using these advanced tools of research. And the rise of precise medicine for the personalized therapies tailored to an individual genetic makeup. This could be the dream. We could dream that this kind of work can happen. But today it is happening and the research is just going on in this kind of fields. So the list is quite long, that includes nanotechnology based drug and drug deliveries, implantable devices, wearable technologies. We are wearing gadgets with us. They will tell you your blood pressure, they will tell you your level of stress and everything, your SpO2 level. So we are having many kind of wearables with us. The drug repurposing and many more fields which are being taken by the researchers in field of pharmaceutical sector. I am confident that the deliberation of this conference will be stimulating, informative, and will inspire new ideas and collaborations that will drive the next generation of pharmaceutical breakthroughs. And the Haryana State branch of IPA remains committed to supporting and promoting research and innovation in pharmaceutical sciences, and we strongly believe that this conference will be a significant step in that direction. And I extend my sincere gratitude to the organizing committee and all participants for their enthusiastic involvement in this important event. And I wish you all a productive learning time here at this beautiful campus of Geeta University. Thank you very much.
Thank you so very much, sir. Now we are truly honored to welcome Dr. Rohit Dutt, sir. He is a versatile educationist, or admirable administrator, a confident leader, and a self-motivated and influential personality with more than 20 years of experience in industry, academia, and research. Please give a big round of applause for him.
A very good afternoon, one and all present here. As rightly said by the Honorable Chief Guest of the day, that we must respect our teachers after the parents. So, सबसे पहले मैं परम श्रद्धेय श्री डीपी भट्ट जी जो हमारे बीच में हैं, जिन्होंने मुझे पढ़ाया है, मैं उनको नमस्कार करता हूँ। The Chief Guest of the day, Dr. Dipen Singh, Chairman Education Regulation Committee, Pharmacy Council of India. While I am listening the CV of Dr. Dipen Singh, I think something has been missed. So it's my duty that I should add some more achievements about our chief guest so that you all can understand that at this age, at this young age, how much he has achieved. So Dr. Dipen Singh is awardee of ICMR Young Indian Biomedical Scientist Award 2019, the most prestigious UGC Raman International Award 2014, UGC Research Award 2012 to 14 by University Grant Commission. He is among the top 2% list of scientists worldwide in the field of pharmacy and pharmacology surveyed by Stanford University in the year 2021. Recently, he has been awarded by APTI for the most prestigious CJ Shishu Award for Research in Pharmaceutical Sciences. So, we can easily understand that he is a teacher, he is a good listener, he is a mentor, he is a regulator, he is doing research, he is publishing widely, and he is here also despite all odds, despite the resistance from the Vice Chancellor of Pandit Ravi Shankar Shukla University. He wished to meet the entire fraternity at Geeta University. So we thank you wholeheartedly on behalf of Geeta University itself, because I think I am a part of Geeta University and the confidence has been given by the Bansal family to me. So it's my prime responsibility that yes, in the times to come, as and when Geeta University needs our assistance, we are here, sir, for 24 hours. I will be failing in my duty if I am not telling about the leadership of this university, especially the Bansal family. So a pessimist complains about the winds, and an optimist try to change it, but a leader sails it. So the sail of this Geeta University has been set by the Bansal family, led by Shri S.P. Bansal ji, Shri Ankush Bansal ji, who is not here, he is abroad, and Shri Nishant Bansal ji. So hats off to you for establishing such a higher education institution in the area of Panipat itself. And I think with your vision, the university will grow in quality as well as in numbers also in the times to come. all accolades, all laurels will bring, I think, definitely come to your university with your vision. Most respected Mandeep Manji, who is a pleasing personality, and it's always you will learn something that whenever you are interacting with such a personality. तो इनका तो मैं एक शेर से जिगर मुरादाबादी का शेर है कि अपना जमाना अपने आप ही बनाते हैं अहले दिल, अपना जमाना अपने आप ही बनाते हैं अहले दिल, हम वो नहीं जिनको जमाने ने बनाया. I am a good teacher also, that's why I am talking differently, because I understand कि आप सब चीजों से बोर हो चुकी हैं, तो मैं आपको भी थोड़ा सा एड्रेस करना चाह रहा हूँ, तो आपका इंटरेस्ट थोड़ा सा बनेगा, क्योंकि it's still another 5 minutes to conclude this ceremony. और मैं नहीं चाहता कि मेरे टाइम में ज्यादा लोग भाग कर यहाँ से चले जाएं या सेमिनार हॉल को छोड़ दें. We have heard about the term artificial intelligence. It's a question to all the students. Any student who can tell who has coined this term artificial intelligence, don't Google it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. अभी आपको एक प्राइज मैं दे देता हूं ऑन द स्पॉट. एआई का आपने कितनी बार आपने एआई का नाम सुना, पर आपने कभी अभी बैठे बैठे गूगल में अपना इंस्टाग्राम रील और मैसेजेस आपने सारे स्क्रॉल कर लिए होंगे, पर किसी ने कोशिश नहीं करी कि ये जो बीमारी हमारे को एआई मिली है ये दी किसने. सर ने भी आपको एक चैप्टर पढ़ाया था, लाइफ लॉन्ग लर्निंग, ट्राई टू लर्न एवरी डे, एवरी टाइम, ईच एंड एवरी मिनट. तो ये आपको देखना चाहिए कि इनोवेटर कौन है. 1955 में एक कंप्यूटर साइंटिस्ट ने जिसको इस टर्म को कॉइन करा, और आज 2025 में हम उसकी बातें कर रहे हैं. तो वी नीड टू अंडरस्टैंड, जब तक ये माइंडसेट नहीं है, क्यूरियोसिटी नहीं है आपके अंदर, तब तक आप कुछ नहीं कर सकते. एक बहुत और इंटरेस्टिंग मेरे पास, मैं गूगल कर रहा था बैठे बैठे, तो आपको एक आईफोन, आईपैड, किंडल, 4G, उबर, एयरबीएनबी, एंड्रॉइड, इंस्टाग्राम, स्नैपचैट, व्हाट्सएप, ये 2006 से पहले एग्जिस्ट ही नहीं करते थे, और आज इसके बिना हम जी नहीं रहे. अब आप दूसरा स्टैटिस्टिक पढ़िए. देखिए, मैं आपको एक टाइम फ्रेम बता रहा हूं that these facilities has taken how much time to reach 100 million population. तो जो हमारा टेलीफोन था वो हमारे पास 100 मिलियन तक, it took 75 years to reach to 100 million. Simple telephone. Then web surfing, web development, it took 7 years. Then Facebook, how many years? How many years? अब वो क्वेश्चन नहीं पूछोगे मैंने शुरू कब कर रहा था, क्योंकि मुझे पता है क्वेश्चन लीक हो चुका है. आई एम ए स्मार्ट टीचर आल्सो. फेसबुक 4 years, इंस्टाग्राम 2 years, पॉपमैन चाइनीज ऐप, चाइनीज गेमिंग ऐप 1 month, टिकटॉक 28 days, and chat GPT only 5 days. So you can understand कि हमारी मतलब की कोई चीज है उसको हम कितना जल्दी अडॉप्ट कर लेते हैं, जो हमारी मतलब की चीज नहीं होती उसको हम अवॉइड करते रहते हैं. तो यही आपका लेसन है कि फार्मेसी में आपने एडमिशन लिया है. सो देयर आर सो मेनी बज़वर्ड्स दीज डेज. इट टेक्स अराउंड 10 to 12 years or more, maybe more than those years to develop a drug with $1 billion investment. Still, after some 10 to 15 years, you will find that drug is resistant to the normal viral organism or the bacterial organism, and all efforts have been gone in vain. But COVID-19 is a brilliant example. When there is an emergency around the world, in a span of 1 year, you have the clinical candidates, vaccine candidates. How it is possible? Because that was the emergent situation. All protocols have been relaxed. The people from different domains have joined their hands, their expertise, and we made it possible to have a vaccine candidate. So why cannot we cannot join the hand for the development of medicine for dengue in a span of 1 year? Still we are not having a single medicine for dengue, but the clinical trials are going on. So you will have some good candidates, drug candidates, but what will happen when the drug will come to us and the virus is many times, I think, resistant to that particular clinical candidate. So you need to understand there is a need to speed up this drug discovery process for the welfare of humanity itself. So you need to think out of the box. Alone you cannot do wonders. You need to talk to your chemistry person, you need to talk to a biotechnologist, you need to talk to a computer scientist, because on an average there are 3.5 million publications around the year. And so much data has been generated. How it is possible to screen those data without the help of application? And if we are not aware of the computational intelligence, I think it will be hard to learn. So you need to look into it. Apart from doing your normal study, you need to join hand, you need to talk to person of different domains, you need to identify your passion, you need to develop your passion over the years. 4-5 years you are here for your bachelor's and master, you need to take it very seriously. आपको बनना क्या है वो जरूर अपने माइंड में रखिए. आज हम आपसे क्वेश्चन पूछेंगे तो आप अजीब सा आंसर देंगे. किसी दोस्त ने कोई बोल दिया मैं ड्रग इंस्पेक्टर बन जाऊंगा, मैं अपनी कंपनी खोल लूंगा, मैं केमिस्ट शॉप खोल लूंगा. जो भी आपको बनना है प्लीज उसका एक पाथ डिजाइन कीजिए कि मुझे को बनना कैसे है और कौन से ऐसे लोग हैं जो रोल मॉडल हैं इस फील्ड में. आपके सामने 2-3 रोल मॉडल बैठे हैं, तो आप इनमें से आप पूछिए, इनसे बात कीजिए. जब आप डिस्कस करेंगे तभी इसका फायदा होता है. नहीं तो जावला जी ने मुझे पता है अटेंडेंस दे दी होगी आपको उस कॉन्फ्रेंस हॉल में बैठने के लिए, कोई और लालच भी दे दिया होगा कि कोई बात नहीं 2-4 नंबर हम इंटरनल में बढ़ा देंगे. ये लालच देना पड़ता है, शर्मनाक है स्थिति, क्या करें. स्टूडेंट ऐसा है और टीचर भी ऐसी है. मैं आपको गाली नहीं देता हूँ, मैं अपने आप को भी देता हूँ. वो पुराने टीचर नहीं है, वो पुराने स्टूडेंट नहीं है, पर हम बन सकते हैं क्योंकि कॉन्फ्रेंस है, चर्चा का विषय है, तो हम सब मिलकर ये बन सकते हैं. ताकि गीता यूनिवर्सिटी ने जो इतना एफर्ट्स करें इस ब्यूटीफुल कैंपस को डेवलप करने के लिए, और ओवर द ईयर मेरे को लगता है कि आई एम कॉन्फिडेंट कि यूनिवर्सिटी के अंदर आप बहुत स्टेट ऑफ द आर्ट फैसिलिटीज और देखेंगे. तो आप फाउंडर स्टूडेंट्स हैं इस यूनिवर्सिटी के, और ऐसी कोई चीज नहीं जो हम मिलकर डेवलप नहीं कर सकते. तो मेरा विश्वास है कि आप सब हमारी बातों को सुनेंगे. जो बातें आपको सुबह से सुनाई गई है, अगर 2-4 बच्चे भी हमारी बातें सुन के डेवलप हो गए, हम समझेंगे कि हमारा पर्पज यहाँ आने का हल हो गया. और बच्चों के लिए मैं एक बात कहना चाहता हूँ, जब आप कोशिश नहीं करेंगे तो कुछ नहीं होगा. मंजिलें मिल जाएंगी यूं ही भटकते भटकते, मंजिलें मिल जाएंगी यूं ही भटकते भटकते. गुमराह तो वो है जो घर से निकला ही नहीं. धन्यवाद.
Thank you so much, sir. It was such a fascinating way to transfer your message. Thank you very much. And sir, I want to inform you that it was my favorite quote too. Now, may I request our Honorable Pro Chancellor, sir, Mr. Nishant Bansal ji, to felicitate our Chief Guest, Dr. Dipendra Singh. And I request our Vice Chancellor, sir, Professor Dr. Vikas Singh, Pro Vice Chancellor, sir, Professor Dr. Gulshan Chauhan, sir, respective Principal, sir, Dr. Sunil Javla, to join the Pro Chancellor, sir. Give a huge round of applause. Thank you so much. I humbly invite Shri Mandeep Man sir.
Now I request Dr. Anurag Thakkar sir.
Thank you, sir. With a great honor, I request to Dr. Rohit Dutt sir.
Now I humbly invite Professor Dr. D.C. Bhatt, our resource person.
Thank you, sir. Now I request Dr. Mukesh Kumar sir.
With great honor, I request Dr. Vineet Mittal sir.
Dr. Vineet Mittal sir. Now I warmly invite Professor Dr. Rakesh Kumar sir, Dr. Ritu Kataria ma'am, Dr. Ritu Kataria. With great honor, I request Dr. Rahul Sharma sir. Dr. Rakesh Kumar sir. Dr. Rahul Sharma, sir. Dr. Rahul Sharma, sir. Now I warmly invite Dr. Ashima Huda ma'am. Thank you so much, sir. Now I request Dr. Shumita ma'am. Thank you so much to all the dignitaries present here and dear students. Lunch is now served. Let's take this opportunity to connect, reflect and refuel yourself. Please reassemble. But before this, now I would like to request or invite Dr. Sarita Khatkar ma'am for the vote of thanks. Please give a big round of applause.
A very good afternoon to everyone present here. Today I am deeply honored and grateful to deliver the vote of thanks on this memorable occasion. I, Dr. Sarita Khatkar, on the behalf of Geeta Institute of Pharmacy, Geeta University, extend our heartfelt appreciation to everyone who have contributed to make this second international conference on new frontiers of pharmacy education, pharmaceutical research 2025 a grand success. First and foremost, I would like to express our deepest gratitude to our Honorable Chief Guest, Dr. Dipender Singh Sir, Chairman ERC at Pharmacy Council of India. Sir, your gracious presence, insightful words and encouragement have truly elevated the spirit of this gathering. Your experience and vision have left a lasting impression on all of us, and we are inspired to carry your message forward in our academic and professional journey. Our sincere thanks to Shri Mandeep Man, Member Executive Council IPA, Honorable Secretary IPA Haryana Branch and Drug Controller Rohtak for your support and for being an integral part of this event. We also extend our gratitude to Dr. Anurag Khatkar, President IPA Haryana Branch, Dr. Rohit Dutt, Vice President Northern Region APTI, Professor Dr. DC Bhatt and Dr. Mukesh Kumar for your enriched presence and valuable contribution to the proceedings. A special words and thanks to the Honorable Shri Nishant Bansal, Pro Chancellor, Geeta University, whose visionary leadership has always guided us towards excellence. We are equally grateful to our worthy Vice Chancellor, Dr. Vikas Singh Ji, and Honorable Pro Vice Chancellor Dr. Gulshan Chauhan for their constant encouragement, support and blessings which empower us to aim higher and achieve more. Our heartfelt thanks to our respected Principal Dr. Sunil Chawla for his unwavering support, continuous motivation and dynamic leadership. Sir, your guidance is the foundation on which we build every successful endeavor. To our esteemed faculty members, thank you for your relentless efforts, thoughtful coordination, and for being the true pillar of this institution. To our organizing committee, technical team, volunteers, students, your behind-the-scene hard work and dedication has ensured the smooth execution of every detail, and we are immensely proud of your commitment. Finally, I would like to thank all our speakers, guests and participants, both national and international, who joined us today and make this event eventually rich and globally relevant. Let us forward the knowledge, insights and connection made here today to the new heights of innovation and collaboration. Thank you once again and wishing everyone continuous success and prosperity. Jai Hind, Jai Bharat. Thank you.
Thank you so much, ma'am. So lunch is ready. Take this opportunity to connect, reflect and refuel yourself. Please reassemble here by 2:30 p.m. This is only for the only for 30 minutes break.